Welcome to your video lecture on section 17.3 on the hypothalamus and pituitary gland. We'll start off discussing the hypothalamus. This is going to provide the highest level of endocrine control. Like I said, the hypothalamus is in charge of having a lot of releasing and inhibiting hormones. So it really is telling the pituitary gland what to do. I always like to call the hypothalamus the parent of the pituitary gland. So we will see also it integrates the activities of our nervous system and the endocrine system. If you look at this zoomed in image of our hypothalamus up here and the pituitary gland, you may note that we have these neurons here that will assist us with the endocrine system. So our hypothalamus is going to accomplish integration through three mechanisms. We've got our autonomic centers. It synthesizes two hormones, and it also secretes regulatory hormones. Let's go ahead and talk about the autonomic centers. Our autonomic centers are going to exert a direct neural control of the endocrine cells, and this really only takes place in one case. So here is our hypothalamus, and through our sympathetic nervous system, we send an impulse through, and you could see it is now going through our spinal cord and moving out through the ventral root and over to the medulla of our adrenal gland. Remember, this gland sits on top of the kidneys. And inside the medulla here, we have our chromaffin cells. And our chromaffin cells, here's a nice little view of what that tissue looks like. Our chromaffin cells in here are going to have a similar tissue to the postganglionic neurons. And so when the sympathetic division is activated, we get this stimulation of the nervous tissue, which is the chromaffin cells here, to stimulate our adrenal gland. And we are going to then want to secrete epinephrine and norepinephrine. Now for the hormones that the hypothalamus synthesizes or creates. First, we have our antidiuretic hormone, or ADH, and this is going to take place, as far as its synthesis, within our paraventricular nucleus, and then it's brought down through the axons and stored in the posterior pituitary gland. So what I just kind of demonstrated here was that transport along the axons within the infundibulum, this is the stalk of the pituitary gland, to this posterior lobe of our pituitary gland. So we're going to store it here until we need it, and then we can secrete it. Our other hormone is oxytocin, and oxytocin is synthesized here in our supraoptic nucleus. It too will travel down the axons through the stalk of the pituitary gland, also called the infundibulum, and be stored here in the posterior pituitary gland, which when needed can then be released through the bloodstream. And lastly, we'll talk about some of the regulatory hormones. We said that we secrete regulatory hormones to control secretions of the anterior pituitary gland. So these hormones are called releasing hormones and inhibiting hormones. So depending on what we want the body to do, we will here in the hypothalamus send over a releasing hormone that will travel through what we call the hypophyseal portal system. Note that anytime we have a portal system, we have two capillary beds. So here you could see the first capillary bed, and down here it is connected to our second capillary bed. And these capillaries are fenestrated capillaries, so we do have more permeability, and we can move these hormones along and out through the anterior pituitary gland. Now, I've mentioned before that the pituitary gland is known as the master gland. It is also known as the hypophysis. And the area that we find the pituitary gland in is that sella turcica, Turkish saddle, of the sphenoid bone. We also see that it's connected to the hypothalamus up here through the infundibulum, which is that stalk of the pituitary gland. And we have already mentioned that we have two lobes of the pituitary gland. The anterior lobe is also known as the adenohypophysis. Adeno really refers to like a glandular type of tissue. And our posterior lobe, which is known as our neurohypophysis. Now, our neurohypophysis, you can see here, has a lot of the neurons moving on down from the hypothalamus, and some of these include the specific nuclei that are going to secrete, or rather synthesize up here, ADH and oxytocin, and then bring it down to the posterior pituitary gland. Let's dive in a little bit deeper into that neurohypophysis. So we talked about the posterior lobe of the pituitary gland is connected to the hypothalamus through the infundibulum, and we see these axons within our infundibulum. We are going to call this area where the axons move through the hypothalamo-hypophyseal tract. So the way we get that name is hypothalamo is referring to our hypothalamus. Hypophyseal is referring to our pituitary gland, and anything that is going to have axons, multiple axons moving through it, is called a tract. And we are going to have the specific nuclei here in the hypothalamus create our antidiuretic hormone and oxytocin, which we are going to bring down through those axons, and then we are going to store it in the posterior pituitary gland. So we can move into the tissue in this area until it is needed, and then we're going to put it within this capillary bed, and it can leave out this vein to then travel to its target tissue. With oxytocin, we are going to travel to, let's say, your uterus to cause uterine contractions. We have other uses for oxytocin too, but we'll leave it at that for right now. And then your antidiuretic hormone would travel to your kidneys. So let's dive in a little bit deeper to that antidiuretic hormone first. ADH is also known as vasopressin, especially if you're just having a wonderful chat with an older health professional about ADH, they may refer to it more as vasopressin. And so its job is to increase water reabsorption within the renal tubules of our kidney. Now, we will look into this a bit more once we talk about the urinary system, but essentially what I want you to know is that there is a tubule within the kidney, you may know this as a nephron, that ends as a collecting duct. And in this collecting duct, we are going to put in some channels called aquaporins that will allow water to be reabsorbed, meaning we're taking the water from these tubules that would end up as urine and instead reabsorbing it back into our blood so that we don't lose that water. So the result is a decrease in water loss. Now, for our oxytocin, we've already talked about how it's going to help the uterus contract, but the other thing that it does is after delivery, it is going to help stimulate the ejection of milk. So I always kind of thought, whatever hormone is helping to make that milk, it's probably helping it move out of the breast as well. But it turns out there's actually two different hormones that help with this. So we'll soon talk about prolactin. Prolactin is the hormone that helps synthesize the milk here in the mammary glands. And in order to allow that milk to be released, we need oxytocin. So oxytocin is increased when we are let's say around our baby. When we see a picture of them, obviously if they are in front of us, if we were to watch a video of them or hear them crying, that may cause an increase in oxytocin. And so even before you have that baby latched onto the breast, that may cause the milk to leak out. And in both sexes, this oxytocin is known as the cuddle hormone, or I like to call it the love hormone, because it surges during arousal as well as orgasm. Now let's move into the adenohypophysis. This is the anterior pituitary gland. Remember, also known as our anterior lobe of the pituitary gland, and is going to be connected through to the hypothalamus through what we call the hypophyseal portal system. And so we don't have the axons really moving through the infundibulum here. Instead, we have blood vessels, and the neurons are stopping in the hypothalamus. So we will have the hypothalamus send over releasing hormones or inhibiting hormones, and that helps to control the hormones that are released from the anterior pituitary gland. And I've said that the pituitary gland is a master gland. Now you're really going to see it, because the anterior pituitary gland is in charge of secreting, I should say, synthesizing and secreting all of these hormones. So we have our thyroid stimulating hormone, TSH, adrenocorticotropic hormone, ACTH, follicle stimulating hormone, or FSH, luteinizing hormone, LH, growth hormone, GH, prolactin, PRL, and lastly, our melanocyte stimulating hormone, or MSH. So let's go ahead and investigate each one of these hormones, starting with our thyroid stimulating hormone, or TSH. What is going to happen is our hypothalamus will secrete a thyrotropin releasing hormone. That goes to the anterior pituitary gland and tells it to secrete TSH. And so this is then going to travel to our thyroid gland. If you remember the thyroid gland in our neck, it is that bow tie looking like gland. And this then is going to stimulate the thyroid to grow and increase the secretion of our thyroid hormones known as T3, which is triiodothyronine, and T4, which is thyroxine. And that hormone can then move into our peripheral tissues to help set up a basal metabolic rate for the chemical reactions that take place within their cells. Let's move on to our adrenocorticotropic hormone, or ACTH. This is also known as corticotropin. And so we're going to start at the hypothalamus once again. The hypothalamus releases our corticotropin releasing hormone. That travels to the pituitary gland, tells it to release ACTH, which then travels to the cortex of the adrenal gland and causes it to release cortisol. So you can kind of see, as we're going through all of these, there is a pattern. Starting at the hypothalamus, we have a releasing hormone. Go to the pituitary gland, release another hormone. That hormone travels to the endocrine gland, causes it to release another hormone. So we're going to follow that same path here with our follicle stimulating hormone, or FSH, or gonadotropin. So in the hypothalamus, we are first going to release the gonadotropin releasing hormone. That travels to our pituitary gland, telling it to secrete our follicle stimulating hormone. Now, this was first discovered in people who have ovaries, and so it is going to promote ovarian follicles to develop. Here's an example or some images of what these follicles look like. Essentially, we're getting lots of cells, and as these follicular cells grow, we are going to start allowing them to release estrogen, which helps support the egg. So The follicles develop in female and in conjunction will also have the luteinizing hormone, which we'll talk about in just a minute. But like I said, the goal of this is to also stimulate estrogens from those follicles. In males, FSH doesn't stimulate follicles, but instead promotes physical maturation in sperm. So it's going to go over to the testes where spermatogenesis takes place to help support that process. Now let's talk about the luteinizing hormone. So this is great because you only need one flashcard for the gonadotrophin releasing hormone from the hypothalamus. It is going to go to the anterior pituitary gland and tell it to release luteinizing hormone. So GRH is going to stimulate FSH and LH secretion from the pituitary gland, specifically anterior pituitary gland. And by doing this, LH travels to our ovaries and testes, depending on which organ you have here. And in people who have testes, it'll stimulate production of sex hormones known as androgens, specifically testosterone. And within people who have ovaries, it will cause them to secrete estrogen and progesterone from the ovary. Still continuing with our anterior pituitary gland hormones, we have our growth hormone. This is going to be stimulated from the hypothalamus through the growth hormone releasing hormone. And when we have that growth take place and we don't need it to take place anymore, we have our growth hormone inhibiting hormone, again, being released by the hypothalamus. And so let's say we have the releasing hormone, the growth hormone releasing hormone from the hypothalamus. It travels through the infundibulum and then tells the anterior pituitary gland to release the growth hormone. So as an overall function, it's going to stimulate cell growth and reproduction by accelerating the rate of protein synthesis, specifically within our skeletal muscle. We see muscle cells here, and our bone. So our bone cells, especially those osteoblasts, are going to be put to work. There are some other effects that take place here as well. Now for prolactin, I've talked about this hormone already. We are going to have a prolactin releasing hormone from the pituitary gland move into the pituitary gland and tell it to release prolactin, synthesize and release prolactin. Now in most of us, we are not lactating. So what the hypothalamus does is it releases a prolactin inhibiting hormone, PIH, which stops prolactin from being secreted so that we don't produce milk. So let's say prolactin is released. We are going to have it work with other hormones to stimulate the mammary gland and the development and the production of milk during pregnancy and nursing. Lastly, we have our melanocyte stimulating hormone. This is going to stimulate our melanocytes within our skin. If you remember from our integumentary system lecture, this is going to be found in that basal layer of our epidermis, and it will cause an increase in production of melanin, which gives that dark pigmentation, the black-brown pigmentation, to our skin.